Medication can cure disease, control a condition, and ease pain. Medication can help our clients have a better quality of life and allow them some independence. Some medications are put in the mouth and swallowed. There are also medications which are placed under the tongue. They are absorbed into the body and should not be swallowed. There are a whole range of medications which are applied to the skin.
Yeah, well, it looks a little bit nasty.
And some clients use inhalers. Some medications can only be prescribed by a doctor. And prescribed medication can only be provided by a pharmacist.
Thank you very much.
Only a pharmacist, a doctor, a registered nurse or a family member is allowed to put medication into this type of container. Some medications can be bought without a prescription. This is called over-the-counter medication.
Paracetamol. You can get that over the counter.
The organisation you work for has guidelines about how you may assist your client with self-medication. Read these guidelines because they are there to help you. You must follow the guidelines. If you do not understand anything, ask your supervisor and they will explain it to you. If your client needs to take medication, then a doctor or nurse has assessed them and has made sure that your client understands what medication they are taking and any unwanted side effects that might happen. Your client's care plan will set out what medications they are taking, when they need to take it, and how they take it. Your supervisor will explain in the care plan what you can do to assist. You need to know your client's care plan and follow it. Do not change anything in the care plan. When we say self-medicates, it means that the person controls their own medication. You do not give them their medication. That is not part of your job. So how can you assist or help? If it is necessary, remind your clients to take their medication. Together with your client, check that they are taking the right medication. Check the day, check the time. Encourage your client to do as much as possible themselves. The client will take the medication themselves. Have some liquid there to help them swallow. If everything has gone according to plan and the client has no concerns, then there's nothing to report. Check the expiry date on any medication and tell your supervisor if the medication is past its use-by date. Talk to your supervisor regularly to check if there have been any changes to your client's medication made by the doctor.
Wilma's medications.
It's important that you watch carefully when your client takes their medication. Stay with them. Be sure they have swallowed it successfully. Provide more water if they need it. Listen to what your client tells you about how they are feeling. Report any changes, such as feeling dizzy or nauseous, headaches, increased sleepiness, rashes, or changed breathing. If they tell you they are feeling ill, or if you observe any changes in your client's behaviour, tell your supervisor immediately. Sometimes things go wrong. What if your client refuses to take their medication?
No.
What if the container is empty? What if the medication drops to the floor? What if your client has difficulty in swallowing their medication? What if your client has missed taking their medication?
Wilma!
What if your client or a family member asks you to make a change to their medication in any way? What do you do? If something goes wrong, if you see any changes, or your client tells you about any changes to do with their medication, report it to your supervisor immediately. Write what happened on a feedback form or whatever type of written communication your organisation uses. Send it into the office. When you write information down, only write what you saw. For example, write, Wilma was crying when I arrived today and had very red cheeks. That's what you saw. Don't write, Wilma was upset and very flushed and I believe her medication was causing this. You are not expected to write down or give your opinion. Always wear disposable gloves if you apply creams, patches or powders to a client. When you have finished, always take them off and dispose of them correctly. Then wash your hands. So if you are required to assist your client when they self-medicate, you need to read your organisation's guidelines and understand them. Know your client's care plan, which tells you what you can do to assist your client with medication. Observe the client before, during and after they take their medication. Report any changes or concerns as soon as possible to your supervisor and write down those changes or concerns. Follow these steps to assist your clients when they self-medicate. This will help maintain your clients' well-being and their independence.